Hello and welcome to the Collective Impact in Health webinar. All viewers are in a listen-only mode for today's presentation. You will be able to listen to this presentation via your computer speakers. If you wish to ask a question during this live presentation, you may enter all questions in the Q&A box located on the left-hand side of your player. I now wish to introduce to you John Kania.
Hello, everyone. Welcome to today's webinar on collective impact in health. As our moderator said, my name is John Kania. I'm a managing director at FSG, a nonprofit consulting firm that focuses on better ways to solve social problems. I am also co-author of numerous articles and publications on collective impact, and I will be the host for our webinar today. We have over 250 people registered for this webinar. And participants come from a variety of sectors. Nonprofit, government, corporation, and academia are all represented on this call. We're delighted you could join us for what promises to be a scintillating discussion of the opportunities to make significant progress in improving health outcomes through collective impact. Next slide, please. We have a terrific agenda for today, and here's how we're going to allocate our time over the next hour. I'll begin with a brief overview of collective impact and its particular and increasing relevance to players in the healthcare sector. And then we'll hear from three practitioners from across the United States who are applying the principles of collective impact in their communities. We'll hear first from Karen Ordonez, Executive Director of the Children's Healthcare Alliance of Wisconsin, which is an umbrella organization for several different collective impact efforts in health. Following Karen, we'll hear from Christy Reeves of the Blue Cross and Blue Shield of Louisiana Foundation, who will share how her organization has used collective impact to inspire a statewide effort to support healthy eating and active living. And finally, we'll hear from Dr. Tori Rogers, Director of Let's Go in Maine, a statewide effort to prevent childhood obesity. The presentations are brief and should allow us 20 to 25 minutes for Q&A from all of you, so please feel free to email in your questions as they occur to you. I will play the MC in terms of fielding your questions and your questions for the panelists, and I'll also provide some closing comments at the conclusion of the hour. Next slide, please. Since Mark Kramer and I published our first article on collective impact in the winter 2011 edition of Stanford Social Innovation Review, enthusiasm continues to grow about collective impact as an approach to bringing about large-scale social progress. In some respects, the initial article served as a clarion call to many who work in the sector who embrace the core premise that we articulated, which is this: that to achieve large-scale change against our serious social and environmental problems, we need to approach things very differently than we often do today. We need to move beyond working in isolated ways, as individual organizations pursuing single-point interventions, to working collectively to align and coordinate multiple efforts and interventions against clearly defined goals. Today, only after 3 years of the concept of collective impact being introduced, we're seeing worldwide use of the collective impact principles we've articulated. Many of you may be familiar with the principles of collective impact, but many may not. So let's briefly review what makes collective impact collective impact. Next slide, please. The genesis of the research that we did, which led to collective impact, was an effort to address the simple question of what does it take to achieve large-scale change against complex social problems. We see so many efforts against social problems that achieve results for small numbers of people, but achieving major progress at large scale has proved elusive. And that's true whether you're talking issues in education, economic development, the environment, or healthcare. Really, with any complex social issue you can think of, it's hard to find even a handful of initiatives that can show results at a large scale. What's exciting is that with the notion of collective impact as our lens, we were able to identify through our initial research not a lot, but a few compelling cross-sector collaborative efforts that in fact were achieving positive and consistent progress at scale. And through examining these few initiatives, we identified a set of 5 conditions that they all had in common that, in our opinion, constitute key factors for success in achieving large-scale change. And here are the 5 conditions that you see on this slide that we found for large-scale progress. The first is that efforts achieving collective impact began by developing a common agenda among a cross-set of actors who touched an issue. The issue could be improving high school graduation or cleaning up a river or improving a community's health, but in each case the efforts began with the stakeholders coming together to develop a common understanding of the problem, and they also agreed to take a joint approach to solving it through agreed upon action. That's a common agenda. Second, stakeholders came together and developed a shared approach to measurement, what we call shared measurement, consistently measuring results on a short list of indicators at both the community level and across all participating organizations in order to make the efforts that they were engaged in remain aligned. The third condition was mutually reinforcing activities. This doesn't mean that everyone does the same thing, but the participants undertake the specific set of activities which their organizations excel in a way that supports and is coordinated with the actions of others. The fourth condition we found was continuous communication among the participants who need to work together to make progress happen. All of the initiatives we studied held monthly or even bi-weekly in-person meetings among the organizations that were participating, even involving CEO-level leaders. And the final condition that we found in terms of supporting collective impact was the existence of what we called a backbone organization. Backbone organizations play the critical role of maintaining the overall coherence of the work, facilitating process and meetings, and collecting data and measuring progress. Their key role is aligning and coordinating the myriad efforts necessary to make progress against the complex problem. Now, it's interesting that one of the things that we found was that failure to identify and establish a backbone organization is one of the most frequent reasons why cross-sector collaborations fail. Increasingly, over the last 2 years, we've seen significant uptake in resonance of collective impact in the health sector. Next slide, please. Now, one might ask, why the recent interest in collective impact in health? Well, for starters, in the course of the current healthcare reform efforts, there has never been at a time in the last 50 years when the healthcare market has been under such strain of transition. And there has never been a time when so many traditional healthcare players have been compelled to work with other organizations outside of the strict healthcare field. We've collaborated over the last several years with some of the largest healthcare systems in the country, and here's what we're seeing in terms of newer drivers of change. First, increasingly, providers are being paid for taking on the risk of keeping people from getting sick, not just treating people when they arrive at the hospital or the doctor's office, but addressing prevention of sickness, which means they're needing to get outside the walls of the hospital to work with other organizations who can contribute to a person's wellness. Wow, what a different paradigm. Second, financial pressures are becoming more acute. In a post-reform world, the reimbursement rate for patients is dropping for the commercially insured, which means providers need to innovate to lower cost. For example, by finding ways to treat people in lower cost settings than the traditional clinical settings. And third, we're seeing a changing role of community benefit as hospitals can no longer justify nonprofit status solely on the basis of giving away charity care. They need to find other ways to demonstrate that they are providing a public good, which is driving many providers to embrace the role of public health. We're seeing these key drivers echoed in the evolving priorities of healthcare funders as well. Key priorities that we see among funders, we've listed them on the right of this slide: community health, preventing unnecessary acute care, strengthening the safety net, improving coordinated care, and helping patients become more active participants in their own health. All of these point to an increased emphasis on prevention, drawing healthcare providers into contact with many players outside the traditional healthcare system. Next slide, please. Now, the picture on this page is one that I'm sure many of you have seen in different forms, moving from the inner circle of factors determining a person's health and health behaviors to a broader set of socioeconomic, cultural, and environmental determinants of health. As you move beyond the individual determinants of health, it quickly becomes clear that the broader determinants of health are beyond the control or significant influence of healthcare providers. And this is a way for those in healthcare to think about collective impact. Collective impact in health is a powerful way to address the outer rings, the social and environmental determinants of health. For example, as we think about preventing childhood obesity, we can think about the food system's impact on a child's eating intake. And yes, the doctor can recommend a healthy diet for the child, but what's the quality and quantity of the food the child's family can afford? This gets into the need to affect the factors impacting the food system broadly, something that's well beyond the doctor's purview. So we find the increasing need for healthcare providers to interact with a broad set of participants, players such as those listed in the blue box on this page. These are some of the players who can begin to affect the broader system, but this is just the beginning. For example, in an asthma wellness collective impact effort we're currently supporting in Dallas, there are even less traditional players at the table, such as public transit authorities, public housing authorities, restaurant associations, after-school programs, daycare programs, and even EPA officials, players well outside of health who nonetheless have influence on factors affecting asthma wellness. Next slide, please. Our experience to date in implementing collective impact in health is that the health sector does encounter some unique challenges to large-scale collaboration relative to other sectors such as education and the environment, and we want to acknowledge that. But we do see ways that even these challenges can be mitigated. First, relative to other sectors such as education, where, for example, with education, apart from the locations where there are charter schools, there's not overt competition between providers. There is significant competition, as we all know, in health for patients and funding. Hospitals compete with other hospitals. Physician practices compete with other physician practices. Second, we know that one of the biggest barriers to improving the quality and lowering costs is that there's a question of who gets the savings. Historically, this has been a large issue contributing to poor collaboration in health. Appropriately involving organizations in jointly developing a common agenda and working in what amounts to a pre-competitive manner in which all benefit by working together more than they each would benefit by working alone is a core tenet of collective impact, and we've seen effective collective impact processes in health mitigate the negative effects of competition. Finally, as we think about this third challenge, collective impact works best when data between organizations is shared. Patient Privacy Acts in healthcare present a challenge to data sharing. However, even here, we're seeing creative ways health-related organizations are sharing data across organizations, de-identifying personal data through involving data-sharing intermediaries, such as hospital councils. Next slide, please. So with this backdrop on collective impact and the opportunities in health, let's turn to some folks who are living into the promise of collective impact in health. We'll turn first to Karen Ordnance. Karen is the Executive Director of the Children's Health Alliance of Wisconsin. Karen, the virtual floor is yours.
Thank you very much. Good afternoon, everyone. It's a pleasure to present to you today. Children's Health Alliance of Wisconsin serves as Wisconsin's voice for children's health. Our mission is to ensure that all children are healthy and safe and able to thrive. Our work consists of raising awareness. We mobilize leaders, we impact public health, and we implement programs that work, such as the Sealant program that I want to talk to you about today as an example of collective impact. Nearly 20 years ago, the Wisconsin Department of Health Services put out a call for someone to step forward and lead an effort to improve child health, either through system change, policy practice, and by bringing others to the table. So at that time, Children's Hospital of Wisconsin led the effort to create Children's Health Alliance and continues to serve as our home. They're our backbone. They provide critical infrastructure, financial support, and, of course, credibility. The Alliance is guided by a statewide 28-member advisory board, and we have everything from a dairy farmer to a doctor on our board. Next slide, please. Here is our logo family. Represents our key initiatives: asthma, early literacy, emergency care, grief and bereavement, injury prevention and child death review, lead poisoning, and oral health. So you might be asking, why these? We work with the State Department of Health Services to determine the areas of greatest need, and those particularly impacting Medicaid or uninsured kids. So for these that you see, the cause for concern is very compelling, and there is a shared vision for what can be done to address these issues. So this is our logo family, and it's very important to our partners and our key initiatives to have a brand identity they can rally around. It provides that common identity for partners that are coming from their individual, their own organizations. So the Alliance is the background, the backbone for each of these initiatives. We're providing the organizational support, and where we have actual coalitions, they are led by an executive committee and a chairperson. So my example of collective impact today is going to be regarding our Oral Health Coalition. So next slide, please. Dental disease is one of the most common chronic diseases of childhood, more common than asthma. Children in Wisconsin that are covered by Medicaid or are uninsured find it very difficult to access preventive or treatment services. It's frustrating because we know exactly what causes tooth decay, and we know exactly how to treat it. We just have not taken sufficient steps to prevent it. So about 10 years ago, the Alliance Advisory Board determined the need for attention to the oral health crisis. It was also at a time where the Surgeon General was speaking out about the oral health epidemic. So the Alliance began building an oral health coalition. We had about 15 members that has now grown to 170. And the primary partners are listed here. Our role is and was then and is today to bring people together and unite around solutions to address the access issue. So our work includes navigating and mediating the differences of opinions within the group. We create a common understanding of the problem, and we've offered a framework for decision making. So one key element is our ability to respect each partner for how they see the problem and how they see the solutions. And our goal is to unite around what the partners have in common and set aside the issues that maybe divide them for another day. So today, we have an oral health plan for the state that is the cookbook of strategies. Groups can align themselves with various strategies based on their philosophy, based on their capacity and their resources. So for example, we have a sealant program. Everybody has agreed that placing sealants on kids is a very wise investment, and the Alliance manages the state sealant program. And so we've created a uniform practice for all programs to follow. We have a common data collection tool. We're able to bring people together to learn from each other. And because we've established that reputation for quality technical support, we've been able to foster relationships such as one with Delta Dental of Wisconsin, who now contributes $250,000 a year in matching funds to the state sealant program. Their partnership was the result of our ability to bring together a group, have data-driven outcomes, and follow an evidence-based program model. Next slide. So here's our results of our collective impact. You can see that we're not going to solve the dental decay problem entirely by a sealant program, but we can certainly demonstrate that one intervention can make a difference when people come together. So these outcomes are dramatic in a 10-year span of reaching more children. And these outcomes have been used to drive further support from policymakers and healthcare systems, school districts, and others that might not likely work together. So our collective impact has been successful because we've had a backbone organization, the Alliance. We are driven by that common agenda. We are measuring our results. We have built strong communication amongst the partners. And most importantly, we have built a multi-pronged approach where partners can work on different solutions that are connected with each other. So the sealant program certainly would not be successful today. Our Oral Health Coalition would not be successful today if it weren't for our ability to bring policymakers and funders, private businesses, professionals together. So I'm going to stop there, and I look forward to your questions.
Great, Karen. Thanks very much for sharing that. You started out by saying that in the leadership of your steering efforts, you have everybody from a dairy farmer to a doctor on the board, which I think most folks would say at least makes for unusual bedfellows. And so I'm curious, you also talked about the fact that, you have folks who have differences coming to the table, and, you help unite folks. Part of your role is helping unite partners around what they have in common. And I'm curious if you might relate a strategy or two that you've seen be successful in doing that.
Absolutely. I would say when you find the common element, so for example, we're talking about oral health, a dentist and hygienist often differ. We united around something that they agreed on, the sealant programs. And by working through setting up a well-run sealant program, you learn from each other, you build a trust with each other, and then some of those issues, for example, if we want to talk mid-level dental providers that can be controversial, you at least have a relationship that you've established where you can have conversation and you can explore those areas where there might be disagreement, but you've used what you've had in common to set the stage and to build the relationship.
That's super helpful, and I think, and you didn't say this, but I think, perhaps it goes without saying, a lot of these people haven't even, had the opportunity or aren't intentionally brought together to actually have those conversations about what they have in common, and that in and of itself is often super helpful. Great.
Excellent point, yes.
Great, thanks. Well, thanks, Karen. Next we'll turn to Christy Reeves. Christy Reeves is with Blue Cross Blue Shield of Louisiana Foundation. Christy, over to you.
Thank you. I'm very excited to be on today. Louisiana is a very unhealthy state. We are, if we look just in terms of obesity, which is the second leading cause of preventable death in the United States, Louisiana is the 5th highest rated in terms of adult obesity and the 4th highest rated in terms of overweight and obese children in the nation. And Blue Cross Blue Shield Louisiana is the largest insurer in the state. And so this is obviously critical to us about the health of our state, because approximately $1.4 billion was spent on obesity and overweight medical-related expenses in Louisiana in the last year. So we are the only insurer in the state with a foundation that is dedicated to building in the community and the health of the community. And so for 20 years we've been focused on that, and I would say we've had a very isolated approach to our projects. One, for example, is called Smart Bodies, which is a program that we've been doing for almost 10 years with LSU, which is wonderful and been very effective teaching kids how to have a smart body, and impacts about 50,000 kids a year. But what we started to realize was that we're not really making a difference. I mean, we are having this isolated impact, but we're not actually having a collective impact where the kids go home and they don't have access to fruits and vegetables and they don't have safe places to play. Then surely, the health of the state isn't going to be impacted. They may have a different perspective, but it's not carrying through. So what do? So a couple of years ago, we created a challenge for a healthier Louisiana, which is basically what you see here. We were looking for innovative projects that would really address what are the root causes of obesity. But we didn't want them to have isolated impact. We wanted them to have multiple collaborators so that we would impact the community as a whole. And they could be environmental, roads, sidewalks and parks and whatnot, but they also needed to have parent involvement and just multiple levels and address the specific needs of the community, and then have an evaluation piece of it. And we were so interested in this that we actually partnered with a group called Pennington Biomedical Research Center, which is an internationally recognized facility that understands the causes of obesity and chronic disease, but knows how to evaluate that. And we brought them in basically as a backbone organization for this project. They help to craft the evaluation with the grantees, but they also really administer it so that we know that there is financial support and backing of this project so that we feel like it will succeed. So we brought everyone together with this common agenda, and we said we would award grants from $250,000 to $1 million, but they had to have matching funds. And our thought was that would make them come to the table and feel ownership of it and want to continue with it. So if you go to the next slide, you can see what our results have been. We funded 12 projects representing about 200 organizations from across the state, and these projects really represent about $30 million in healthy living initiatives. And the activities obviously are mutually reinforcing activities around our common agenda. And our backbone organization of Pennington absolutely helps keep all of our grantees on track and aware of what each other are doing, but learning from each other. You know, the collective impact model is very much about continuous learning. And so we bring these groups together regularly to learn from each other. We're 1 year into the implementation of these 3-year projects. And we have, you know, one of the 5 conditions is continuous communications. Well, that's very, very important in our scenario as well. Pennington helps facilitate quarterly conversations. They have ongoing phone calls with the groups, and we require all of them to meet in person at least once a year so that we can continue to talk to each other, but also learn from each other. So if you look at the collective impact model, we immediately had a common agenda. We actually got the grantees together in the very beginning and showed them how their activities reinforce each other, so that even though these are 12 projects, they're 12 small collective impact projects that are part of one huge statewide collective impact project. And so those activities, understanding how they reinforce each other, was very critical. And then clearly Pennington being the backbone organization in partnership with us. I mean, we have some staff members that are very engaged in the project and work alongside with it, has been beneficial. And whereas we still value the work and the project that we did with LSU, and we'll continue our Smart Buddies program, we can absolutely see that what this does complements all of that work, but helps to make Louisiana a healthier state. So it's been very exciting to see this, and 1 year out we've already seen 10,000 pounds of new fresh produce and 14 community walks and runs and community gardens and 12 miles of bike paths and 4 miles of walking paths. I mean, it's just been absolutely amazing. And the numbers continue to rise in terms of the people who come to the table, but also the dollars. I mean, not just the $30 million, but we still see additional dollars coming in because we're just getting incredible traction. So that's mine quickly. I know we're going to have questions and answers, so I'll turn it back over to John.
Great, Christy. It's just fascinating, and it's just neat to see that Blue Cross Blue Shield, as a statewide organization, can signal to a whole bunch of communities, a need for more collaboration. And on the other hand, if you're within the nonprofit arena, it would probably not be the first time that a funder would sort of suggest that one collaborate with their peers. And I'm sort of curious, if the list of folks that are here or that you mentioned, it's a very different set of folks, sort of picking up on what we were talking about earlier, that then would usually coordinate or collaborate together. And I'm curious, what you've heard as a funder from your grantees about this level of collaboration. And again, different players, sort of you're asking them to come together, and of course they want the money, but are they seeing the value?
Absolutely. In fact, it's great that you mentioned that. Karen talked about the variety of people that are at the table with her project. We see the same things. I mean, when you have 200 organizations coming together, it's a lot of different players, from farmers to pediatricians and whatnot. And but one of the in our ongoing continuous communication with the grantees, we are asking them about the collaborative, how it differs from other collaboratives that they've had, and all of them have said this has been a game changer in terms of how they see their place in terms of impact in society. And also, I think they're starting to understand that isolated efforts and these loose partnerships from the past just haven't proven effective and sufficient in solving these problems. And that's why we keep coming back together. But on another note, we've also asked the grantees, those that applied that did not get funded, if they felt impacted by the process of it, by looking differently at this. And all of them said absolutely, that they felt it changed their perspective, and they're much more interested in pursuing the collective impact model. So that's been exciting.
That's terrific. Great. Thanks for sharing that. Well, we're going to turn now to Dr. Tori Rogers from Let's Go Maine. Tori, the floor is yours.
Oh, thanks, John. Well, I'm thrilled to be here. Thanks for asking. And as I'm sitting here listening to Karen and Christy talk, You know, in Maine, things are a little different because it's a small state, so we have these variety of players, and actually our farmers are our doctors, so they're the one and the same. So it's pretty amazing. So I want to talk about Let's Go, which is a community-based obesity prevention program, and how we've used the collective impact framework for this program, and what we hope will be a launching off to a statewide framework for Maine's healthy eating, active living programs in the future. Next slide, please. Let's Go uses a multi-setting approach to reach youth and families where they live, learn, work, and play to reinforce the importance of healthy eating and physical activity. We focus on helping to change the environment so that the healthy choice is the easy choice, and you know it's working. This year we worked in all 16 counties in Maine, reaching over 320,000 children. We've seen environments change because gardens are sprouting up everywhere. We've got supportive policies in place, meaning like only healthy food is being served for snacks and celebrations in schools and in child care places. Healthy behaviors are being adopted, less sugary drinks consumption, and obesity rates for some of our age groups appear to be holding steady, which is great, and in some cases actually declining. Before I get into the key components of collective impact, I wanted to talk about the funding model, and I've seen a couple questions come through on this also. For Let's Go, it's been very successful and very interesting. It all started in 2006 when 7 local businesses and health leaders made a decision to pool their resources, money and personnel, to find innovative solutions to the complex problem of childhood obesity. Healthcare leaders like Maine Medical Center and Maine Health were joined by the United Way of Greater Portland, Anthem, the health insurance company, Unum Disability Company, local businesses like Hannaford Brothers, a grocery store, and TD Bank. They all came to the party, and the United Way of Greater Portland took on the responsibility of being the backbone organization. And this was a critical step. The United Way was perfectly situated to do this as the respected leader in our community, as one respected leader in our community. One of the really interesting aspects of this is the founding partners, which we call these initial folks that came to the table, didn't actually know what they were funding. They realized it was going to take innovation, and they allowed the program to develop and emerge based on the community experience and needs, using the best available evidence and building new evidence. Critically, critically important. Once Let's Go started to spread statewide, the decision was made to move the program and the staff over to the Barbara Bush Children's Hospital, where I sit, at Maine Medical Center, because we do work statewide. Interestingly, the founding partners are still at the table after 8 years, and they've been joined by over 20 other additional funders. So now collective impact, now I want to talk about collective impact and how it's really working for Let's Go. I want to talk about 3 key elements: the model, the message, and the strategies. So first, the model. You'll see it in the upper left-hand corner, the puzzle piece. Let's Go works across these settings of early childhood, schools, after-school, healthcare, workplace, and communities, connecting key champions in each of these 6 areas, and this allows for that continuous communication. And in my experience in over 20 years in pediatrics, I've never seen settings really come together until Let's Go. And Let's Go allows for this meaningful conversation and connections to occur. Next, the message on the right-hand part of your screen, 5210. It's easy to remember, provides simple steps, and helps set the common agenda. You know, the message is the what. You know, when you ask people what they do with Let's Go, it's 5210. It's the connector across the site. The message is everywhere on posters, education materials, the sides of bus in our major cities. Now on to the strategies, which is on the left-hand lower part of your screen here. The strategies provide the opportunities for multiple activities and programs to work together, which leads to those mutually reinforcing activities. And the strategies also allowed for shared measurement across the settings. Using these strategies have also allowed us to develop a recognition program for sites of distinction, sites that go above and beyond and really excel, and bringing these settings together under one umbrella. Let's Go provides the guidance, technical assistance, tools, resources, and data analysis to our sites, and this umbrella, Let's Go, is the backbone structure, knitting together these stories of our communities, helping everyone find their part to play, raising a healthy generation of kids. Next slide. So what hasn't worked well? I think it's really, really important to not just say all the great things, but I'll tell you some of the things that we've struggled with. Well, as Let's Go has grown into a statewide program, we've struggled a bit with connecting all the dots in all the programs. Our partners are now coming from all areas of health, education, public government, economic development, even environmental funders. So our challenges have changed a bit, and they center around the following. Words and frameworks. Often the words and frameworks we like program directors, these words and frameworks don't resonate with the folks on the ground. So sorry, John, you're not going to like this, but sometimes words like common agenda, mutually reinforcing activities, these don't mean anything to the public health official or the doc or the teacher that I'm talking to. But 5210 and the Let's Go umbrella, that resonates with them. So sometimes we need to take these words and frameworks and reframe them. Secondly, letting go. You know, it's hard for most of us to acknowledge that to truly collaborate, we have to let go of some elements of our program and some activities we do, even if we really are tied to them. We may have to do things differently. And to do this, we need to have trust and respect in each other and our programs. This takes time. But, you know, we get into this mess over decades, and I think we can afford to take a little bit of time to slow down every now and then and to form the relationships with our colleagues. Accountability and credit. You know, it's really important to have clear lines of accountability when you have so many partners at the table. Who is responsible for providing the technical assistance to the school? Who is responsible for collecting data, analyzing the data, reporting out? For Let's Go, this has been an evolution with our 17 community partners and multiple organizations, including state government, that we work with. And this highlights the need for continuous communication. And credit, really, really important here. How do we share in the successes? Let's Go is not responsible for all the great things that are happening in Maine. How do we acknowledge all of the programs? No one person can do this alone, and the credit must be shared. Lastly, grants. Well, you know, you got to love them, and at times I wonder why I ever applied to some of them. These days, state and federal grants oftentimes have barriers to working together. Sometimes they're real barriers, and other times they're perceived barriers, and that can be overcome through good communication and trust. That said, amongst all these challenges, I truly feel there are tremendous opportunities, and here at Let's Go, we're really ready to start moving in that direction. Thank you, and I'm happy to take any questions.
Thanks, Tori. Well, let me just go back to the first bullet point here, words and frameworks, because I think it is really interesting to hear, you know, you're talking about all these different constituencies coming together, parents and schools and after-school programs and government politicians, et cetera. And your point that, you know, I mean, we often find, you know, in these sort of collaborations that it can be a bit of a Tower of Babel. You know, everybody's got sort of their own terms for different things. And can you say a little bit more about how 5210, you know, has worked to, you know, bring different constituencies together?
Sure. It's really the story of 5210 is just fascinating. What 5210 does is take the frameworks and the things that we need to do our program as well and make it just easily and actionable for the people on the ground that really have to do the work that we have to measure. So when we talk about, like, oh, mutually reinforcing activities and you want to do these things, people are like, what are you talking about? And I'm like, well, 5210 and the walking school bus, you like that program? Yeah. Oh, well, you know, that's the one. That's the movement. Oh, I get it. So, you know, and then they say, we'll say, well, you know, that fruit and veggie program that the USDA has for low-income kids. Oh, yeah, we use that. Geez, that's about like zero. You're not sugary drinks here, and you're doing more fruits and vegetables. So it's sort of reframing it into action steps that people can start doing tomorrow. People, I think, are pretty tired of having to plan for 4 or 5 months to do something. There's simple steps that we can do every day, at least in the arena that I work in, and that's sort of been the benefit of 5210.
Yeah, that's great. And, you know, just to hear you talk about it, what I think is also great, you know, it's only 5 characters, 5210, and yet it allows, you know, a whole bunch of different types of people and activities to see themselves in one, you know, comprehensive framework.
You're absolutely right. I was at a function for senior citizens the other day. Not myself, I was with my father, but the group of senior citizens were fascinated at what they could do with 5210, and they said, Tori, can we have a toolkit like you have one for school? And I said, well, let's work on that. But everybody, they sort of also want to join something. So the senior citizens wanted to help out and join something that was happening in the schools. So, you know, it's not a be-all, end-all educational nutrition message, but it is a starting point.
Yeah, great. Thank you. Well, we've got a variety of terrific questions here, and I'll you know, share some with the panelists here. Here's a great question, and I'd love for any or all of you to address this. I have a number of different questions about, you know, as you get these efforts up and running, there's always a challenge in maintaining engagement with the organizations. and individuals, and you get staff turnover, people change. A lot of this seems to be relationship-based work. And what are strategies, tactics to address that? And do you guys see that?
So this is Karen. I can jump in. One, we've been very fortunate to maintain consistent staff at the Alliance, so that has helped tremendously. But as staff change within the community organizations, et cetera, you have to commit to take the time to have conversation, whether it's coffee or discussing a topic, just to keep building those relationships. And oftentimes we let that go, and we value that and we prioritize it.
Great, thanks, Karen. Christy, Tori, any thoughts on how do you deal with this fact of keeping people engaged over time, particularly when folks switch out?
We have the same issue. This is Christy. We've had a lot of people turn over in the 12 different projects, so that's a lot of people potentially. But you anticipate that, and I think the continuous communication absolutely helps with that because we have the infrastructure built that we have to have ongoing conversations. So when a new person comes to play, we spend some time with them and bring them up to speed and just kind of give them. I mean, there was one person that had no idea how anything had even gotten to that point. So, and that level of how you have to bring them up to speed vary so much, but it takes time, and we think that that's important. So we do the same things.
Yep, terrific. Tori, any thoughts?
Yeah, lastly, I think exactly what Christy and Karen said. I think we do a lot of training, and you need to make the training fresh. So my staff knows this, that we need to, when we do training, let's think about how to do it a little differently. So it's new staff that are coming on board, but let's make it fresh and innovative. We also include them in part of the training. So people we trained last year can help us train the people that are coming on board, and that helps their professional skills also.
Yeah, I'll just highlight two things that you guys said that I thought were both terrific. One is this often is a task for the backbone organization, and hopefully you do have continuity within the backbone organization, and they can serve as the community or the institutional memory. And I love Tori's idea of others that are in the initiative. That it's not the backbone may sort of have the responsibility, but we find so much of this work is people talking to people. That sounds rather obvious, but for those that have been involved in the initiative for several years, to be the spokesperson in terms of bringing others who are newer to the initiative up to speed, in our experience, works really well to sort of increase commitment of both the legacy person and the new person. So that's terrific. Great. Well, here's a question, and I'm curious if folks have perspectives on it. The question is being a funder an appropriate role for the backbone organization? I might rephrase that question as, what are the pros and cons of having funding come from the backbone organization? And you guys may just be able to speak to your particular instances, but curious folks' thoughts on that question.
I can go. This is Christy. Clearly, I'm a funder, so I could absolutely see pros and cons. And in one way, the cons could be that we clearly have an agenda. We're a health insurer, so clearly, and that there could be some issues in terms of trust and credibility. With people thinking of whether we're appropriate or we're going to skew it in a certain direction. And I think that's one of the reasons that Pennington is so key to us, that we brought them on as a partner in the backbone. I think a lot of it depends on who that funder is and what their actual agenda is. I don't think it's an issue if it's appropriate and it's aligned with the common agenda and the backbone organization or the funder has the appropriate resources to do it and everybody feels there's credibility there. So, I mean, there's always going to be one certain bad seed funder who might not be the appropriate backbone organization, but in general, I don't find it to be an inappropriate position at all.
Thanks, Christy. Karen and Tori, any thoughts on that, funding from the backbone to others?
Yeah, I mean, I do think that the backbone has to have the credibility of being neutral and not driven by a particular agenda. It doesn't have to be the funder's agenda. It can be other agendas. So, I would just focus on that key element of a backbone, that they be neutral.
Yep, yep. And I think that's what FSG has seen, that that's the critical thing to focus on is, the backbone needs to be perceived as neutral and not carrying any one individual agenda. And that can be really super tough if there is funding that goes through the backbone. It doesn't mean it's impossible, and there are some situations where backbones are functioning really well in their sort of neutral convener role, but also as a funder. But there are clearly things that need to be attended to there.
And John, if we have time, if I could just add, Children's Hospital of Wisconsin is a huge part of our backbone. We couldn't do it without them. They fund us, but they don't drive our agenda.
Right.
And so that's what's really key, and it really is a kudos to Children's for supporting us, but not necessarily driving our agenda.
So this is Tori, so I'll just add into that. So our Children's Hospital here in Maine is the same thing, and I think there's a tremendous role when I think about sustainability, a tremendous role, as you mentioned earlier, John, about hospitals and their community benefits. And children's hospitals, kids spend most of their life outside of the hospital and outside of seeing pediatricians like myself. So we need to be focusing health out in the community, and I think Children's Hospital have a clear role in doing that.
Yeah, and I think you guys are both pointing out, and we've moved from saying backbone organization, which I may have said, to backbone resources, because we find in many instances, particularly in resource-strapped areas, some rural areas, that it's not one organization that takes on all the functions of a backbone. It may be multiple. And or, as in the situations that Karen and Tori described, there are, contributing organizations that, have institutional sustainability that can serve to buttress the efforts of the backbone. I think that's something that we see fairly frequently. Good. Maybe let's shift a bit to how do we know what's working and what do we do when we find out? Bunch of questions about sort of learning and evaluation. And so for all three of you, how do you think about, within your efforts, supporting and approaching continuous learning?
Well, this is Karen. We very much promote evaluating our work and being able to measure it. And so from the get-go, you have to put in place what you're going to measure and how, and then using those results to drive further direction. And then that was clearly evident in our sealant program that started with very small dollars 10 years ago and is quite significant today. And we're using that leverage to hopefully expand as we go forward. But we're doing that in all of our initiatives. And collecting data is really important. And then I would say, too, we've got to, in collecting it, have to be pretty simple. It has to be doable. And it can't be overwhelming to the organizations or the partners involved. And we try and collect only what we need to confirm what we're doing is right and to go forward. And I think that oftentimes we over-collect. We collect a lot of data that never gets used.
Mm-hmm. Mm-hmm. Great, great. Tori, any thoughts? How do you all address continuous learning?
In association, you mean with the the measurement piece to that, John, or just continuous learning?
Yeah, more. Okay, so you got a lot of activities going on, and you're trying to figure out what's working and how you improve and course correct and all that sort of stuff. How do you all approach that?
So we do it a couple different ways. The strategies have been really, really key. So we are working with the sites all year to use food as a reward, to increase physical activity, and then we measure specifically that. So you're tying what you're asking them to do, you're measuring it, very simple measures too. It's self-report, so it's not observational. It's fairly easy for the team at the school or the child care site to do it. And then what we do is we provide that data back to the community leaders that are doing this work, and then we have discussions with it. So we do it a lot of different ways. It's seven times 7 ways. So many of the people that we work with aren't used to data, so we need to take it off data kind of terms and p-values, statistical significance, and make it into relevant terms that make sense to them. The other thing that we're starting to do a lot of is telling stories, and telling them in print and telling them on blogs and telling them in the, 139 characters on Twitter. We're trying to just get the stories out because the stories are what really are moving people and saying like, wow, they built a garden. I think we can do the garden. So we do it lots of different ways, and I think it's really important. And we also are trying to get people to our community partners to talk to each other. And this Let's Go, we at the home office, the backbone, we don't have to do it all. So trying to get them to tell their story from York up to Presque Isle over to Somerset.
Yeah. I want to just reflect or pause on two things that you said that I think really resonate with me. One is bringing people together, not just providing people the data, but actually bringing them together to say, what does it mean, reflecting on the data. And, that's something that is perhaps not given enough attention when we think about things like shared measurement, that it's not just collecting the data and saying how we're doing. It's actually bringing the various players together to reflect on the data. Often they don't look at the data or they don't have the data, certainly not at a community level. And B, they're not brought together to sort of reflect on it and look at it with different eyes. And as Tori pointed out, often you're dealing with folks who, this is sort of not their natural existence, staring at PowerPoint slides or, data in any form. And so, how do you bring it to them in a way where you can have a conversation? And so reflecting on the data, so important. And Tori also go ahead.
So the other thing that was really interesting to us is we've developed this recognition program for sites who implement our 5 priority strategies and throughout the schools or child care sites. And I won't go into the details, but we set up criteria. And then when we did this a couple of years ago, I wasn't sure that if anybody would care if they were a bronze level or gold level or if they wanted to be a Let's Go healthcare site or school. What we found is that they really cared and that the community say like, hey, I want my doc to be a Let's Go healthcare site and I want to take my kids to a Let's Go child care site. That was fascinating too. So you take the data and putting it into something meaningful, which is recognition. And then we've been the communities have been holding these Let's Go celebrations, and I get a chance to go there. And that's that's taking the data and then showing it into something that makes sense to them. Everybody likes to celebrate gardens and healthy kids.
Yeah, cool. That's great. Well, we're getting close to the top of the hour, so I'm going to wrap up the panelist portion here by asking the 3 of you to address this same question. So, we're all on a learning journey with collective impact. And, as much as has been accomplished, we all, I'm sure at least I do, feel there's so much more that we can do. And I'm curious, based on the experience that each of the 3 of you have had, where do you want to go next? What's sort of the next level that you think would be super powerful if your particular initiative were able to accomplish that? And let me start with putting you guys on the spot. Well, listen, I'm going to go in the order of the presenters, which was alphabetical. So unfortunately, Karen, you're first up. Thoughts?
Yeah, no problem. Our goal is always to find the unlikely partners. Who would be interested in this, and who would bring just that additional dynamic? For example, lead poisoning, getting the landlord association or the window manufacturers to the table. Maybe someone that you don't think of when you think of healthcare and lead poisoning. For our oral health initiative, continuing to work with organizations where the kids are, outreach to boys and girls clubs, to schools, getting to more schools. So it's reaching the unlikely partners. And then, of course, our goal is to reduce dental disease amongst kids. This affects their ability to learn. We want kids to learn in school. We want them to be active. Well, who wants to run around? Who wants to read a book when they're sitting there with mouth pain? They can't eat an apple if they don't have healthy teeth. So that's what drives us, and it's just finding those, looking at everyone possible and saying, what connection do they have to kids having healthy teeth? And then we go after them.
Cool. Great. Thanks so much, Karen. Christy, your thoughts?
I would, agree with Karen, is that we're always looking, we think everybody's part of the solution, that we're not the only part of it. And one of the reasons we're so proud of this project is that we're not the only funder. I mean, we are one of hundreds of funders that have come to the table to do it. And what she talked about, just the ones that don't make sense. Like, we have lots of media that are partners, and one example when we were talking to the participants in the beginning was, maybe the airport could be a partner, and think, or business banks and business. I mean, think about how they play a part in your community and how they're part of how they can help with the solution. And we talk a lot about what is the next big thing. For us, it's not just obesity. It's really a mindset and a way of life. And getting people to think differently and even just talk about health, that's very exciting. So all of these different players coming together is what we want to see, and more people at the table, not just the 200 organizations, thousands coming together talking about healthy living.
Yeah, great. Terrific. Thanks, Christy. Tori, your thoughts?
Sure. So a couple areas that we're very excited about in Let's Go. We've had some great partnerships with our state governments, and there's some really great conversations going on about really having thinking about a collective impact for healthy eating, active living for the state. And one specific thing that we're doing, which was terribly exciting, at least for me last week, was that we pulled together at what we call a data user group for health indicators in the state of Maine, not just child health, but any health indicators. And they were program people like myself who want to use the data for programmatic purposes. There were folks at the table who collect the data. There were contractors on the table who analyze the data. And we've agreed to really start to get together and start to figure out where some common measures might be for healthy eating, active living. So we're very excited about that. I think that could be the first step in really a statewide collective impact, bigger than just Let's Go, but for child health.
Great. Well, Karen, Christy, and Tori, this has been a great conversation. We'll need to wrap it up as we approach the top of the hour, but I hope everybody on the phone will give Karen, Christy, and Tori a virtual round of applause. Next slide, please. So I've got two remaining tasks to close out the day. First, we wanted to let folks know that we've just launched an open source public good initiative called the Collective Impact Forum. FSG has launched this in partnership with the Aspen Institute and a number of other important organizations that you see here that are contributing to the spread of knowledge and practice in collective impact. The goals of the Collective Impact Forum are to create the knowledge, networks, and tools to accelerate adoption and increase the rigor of collective impact. We're currently supporting two communities of practice, one with funders, so funders who are interested and passionate about collective impact, and the second community of practice is with backbone organizations. We've actually held a number of events already with both of these communities of practice. So if you are interested in being a part of either of those, certainly do contact us. And in January, we will officially launch the Collective Impact Forum's online digital presence. And with really the goal for the online forum of disseminating knowledge, tools, and practices that support collective impact that are being developed by FSG and Aspen and others engaged in the collective impact movement. We're really interested in bringing the best thinking around collective impact from not only the United States, but really across the world. And our hope is to build a support network for those who are passionate about collective impact. And what we're hoping to do is make the forum site a vibrant and interactive community site. So that will be launching in January. If you could move to the last slide, please. Finally, we'll be sending a brief electronic survey that you'll receive after today's event, and we hope you'll share your feedback. On this slide, you'll see that there are three website addresses to help you access more information on collective impact. There's a host of information on FSG's website, fsg.org, and that's the first website. You can click on the second web address if you'd like to sign up for the Collective Impact Forum. And again, that site will go live in January of 2014, but you'll be connected to the FSG site at this point and have the opportunity to sign up for the Collective Impact Forum. And the last web address will provide you with a recording of today's webinar and the opportunity to download slides from today's presentation. A number of people had questions on that. So this concludes today's webinar. Thank you all for attending, and have a great rest of the day.